Hello everyone, Dr. Sam Schroetke here, Physical Therapy and Hand Clinic of Hillsborough with Technique Tuesday, continuing our theme of hip or sacroiliac joint pain. I've already done one video that was repeated hip extension in half kneeling. I'm going to show progression of that exercise. If you had done that and it decreased or abolished, got rid of your hip pain or your sacroiliac joint pain, stick with that exercise. There's no reason to progress it to this. If you had a little relief or not much of anything, then you might give this one a try. If it made you worse, then don't do it, okay? So this is repeated hip extension and half kneeling with overpressure. Love the name of these techniques, but it says exactly what they are. So again, painful side is down. The side that you're not treating is going to be near a supportive surface for those of us who have balance issues, but it just makes it easier actually to do the technique. Remember with this one, you want to make sure that that front leg is way out there. Okay, it's going to put the hip in a more ideal position, and it's going to encourage us to get into end range. End range is where the magic happens. As I said, I did a previous video, but I think if you are going to respond, if your symptoms are going to respond to hip extension, this is likely the one that's going to work for you. Okay, so this is going to be overpressure. So what I did in the previous video was just extending this way. We want to get farther into hip extension, so we're going to take the heel of our palm, put it on the upper buttock region, and when I go into that extension, I'm going to push a little bit just to go a little farther. So you go pressure on, little push, and then off. Pressure on, push, and then off. Pressure on, push, and then off. Okay? So front foot kicked out very far. We're supported here. Painful side is down. I lunge as far as I can and then get a little push with this hand on my upper buttock. Okay? This is kind of like the GQ pose, I like to say. But this tends to work better because you're getting into end range. It's a little more force. It's helping you get to end range. I would encourage you to do 10 to 15 reps every 3 to 4 hours. Whatever was painful before, sitting, say some people have it when they're sitting or if their knee comes up too high toward their chest, or squatting. If that was painful before doing this exercise, do 10 to 15, recheck it. If it's better, great, golden. It's probably a good exercise for you. And if not, you might have to look at other alternatives. If it's painful, then I wouldn't do it, okay? But check with your physical therapist or physician before doing any of these exercises to make sure they're appropriate for you. Like us on Facebook, leave comments below, ask questions. We'll get back to you about them. Dr. Sam Schroetke here, Physical Therapy and Hand Clinic of Hillsborough.